Test, test. our community, and in our world. And we, each of us and all of us, have committed all that we are to doing good, to making a positive difference. And so, dear God, we ask, let us not tire, let us not become weary in doing good. Let us kindle the flames of hope. Let us fan the fire of trust that we will reap a harvest if we do not give up. For we know that with your divine help, we will accomplish far more than we can ask or hope or imagine. All this we pray in your loving name. Amen.
Amen. Pledge allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Today, we have 3 citizens wishing to address the board, and so each one will have can have up to 3 minutes. I will start with the order that they signed in. Michael Howell, would you come forward?
Yeah, I'm here.
Yes.
Okay, 3 minutes. I'm talking about referrals. I went to the ER at Harris, bleeding, stools and urine. They did a CT scan of my kidneys, and I was packed on one side. He said both sides. So I was referred within Harris to their oncology department. Then I was referred out of their office because they didn't have the machine, they didn't have the urologist to do the kidney procedure. I said, so I called Baylor. And they put me off for like 60 days. So then my wife said, well, just call JPS. I said, great idea, never thought about it. It's been a great experience. It's been incredible. It's an incredible hospital. Nobody in my family, nobody in my friends, nobody comes here for some reason. I have no idea why not. So anyway, we get a referral from urology, Harris to JPS. Well, it hits the front desk, the number you guys give me, whatever number that is. She says, oh, well, this is specialty. They have 14 days, and I don't know whether I'm dying. I don't know what's going on. I just know there's blood everywhere inside me. Okay, oh, it'll be 14 days before they can get back with you. I said, wow, really? And she said, yeah, we used to be able to send you straight to urology, but for some reason, in the flow chart of decision making, our hands are tied. We can't do anything. I said, you're kidding. Okay, now mind you, I'm a big Reagan guy, and I use this silent majority, trust but verify. Hey, they get a fax referral from a urologist who is state licensed, just like the guys here at JPS. Don't hold it up. Send it to your next 14-day pool, which is specialty. So I've got a 14-day pool on the front end. I've got a 14-day pool on the back end. So I'm 28 days before I'm even allowed to receive a phone call telling me where I am in my whatever's going on inside of me. So anyway, so I patiently wait, and then finally I go up here and sit on the floor and go to patient advocate. And she said, well, you got it on May 3rd. And they have until just after sometime, I don't know what day I came up here, but I sat in the middle of the floor, waited my line, and I sit there, and they said, well, they have until this afternoon. Oh, I said, what? And then they have 14 days from this afternoon. So I marched up here to the top floor, and I made an appointment with you guys. I'm an accountant. I have a degree in accounting and management information systems. I've been doing this since 1979. Okay, I've been in around the medical ER field since 1963, when my grandfather died in my bedroom.
Mr. Howell,
Yes,
your 3 minutes, so wrap it up for me.
wrap it up. I'm wrapped up. Somebody look at the workflow for referrals and shorten the 14 days. That's all I'm asking.
All right.
It's not hard.
Okay.
Great hospital, by the way. I love it. Everybody's been so nice.
Right. Thank you. Okay, next I have Charlene Robertson.
Hi, I'm Charlene. I have the same issue with referrals. I have a referral that's been sitting there. The lady called me about 2 weeks ago saying, Ms. Charlene, have anyone called you about this referral? I said, no, ma'am, they haven't. So I went back to my doctor's office trying to get him to do a stat for me because I need this stat. They said that my doctor's office didn't put stat on there, but on all the referrals they gave me the copies of to bring to JPS, they did. So I still haven't got a call from the clinic yet. Then there was a miscommunication with GI doctors with a test that I was supposed to have been doing. Okay, the doctor who told me to bring, my primary care did not send the referral to JPS, and I told the lady I had all the information that she needed. So when the surgeon called me on Friday, she said, well, we're going to have to get back in contact with you because it's a miscommunication. I say, well, when she told y'all about this surgery I'm supposed to be doing, y'all should already had all the information that y'all need. They never called me back yet, and it's Wednesday. She told me I'll be getting a call today. I haven't got one yet. Because my doctor, and another one is that doctors from JPS do not, if you have an outside doctor and then with your insurance goes with JPS, they do not forward the information back to your primary care doctor. I mean, I had to come over here because these tests was important that I had to come over here last week to pick up. The women's clinic told me that they could not forward my information to my primary care doctor. I went to patient relations. I was waiting on the lady in patient relations to call me back to see why they can't do that. Because I have to drive over here to get the information that should have been forwarded back to my primary care. And that's all wrong. Then they put stuff from JPS on you that's not true. And like I went to y'all claim file, you know, where you file your claims at, your appeals and all of that. I even went as high to the executive board. Didn't nobody do nothing. This doctor here at JPS put I was an acute drug user and alcoholic, and he never did none of the tests. Like I told him, my profession is a lab. If you accuse somebody of something, you gotta have black and white to prove it. That's what I don't like. I still got the doctor name who did it, and my stuff never got cleared. When I went to the complaint board told me I was too late. How's I'm too late and it's in the same week? That's my issue.
All right. Thank you. Thank you. For Mr. Howell and Ms. Robertson, someone leave your number.
Shannon.
They will follow up with you. Shannon will follow up with you back there. Get your number and we'll follow up with you.
No, I'm fine.
You're fine. Okay.
I'm good. I'm just trying to help you guys.
Okay. All right. Well, I heard you.
I'm trying to help this hospital be more efficient.
Okay, thank you. Thank you. I just wanted to make sure that you had that we had taken care of it. Okay. All right. Okay. All right. Okay, well, thank you. Our next speaker is Stuart Pickle.
Good afternoon. My name is Stuart Piquel, and I'm really just here to say hi. I'm not here to ask for anything. I just am coming as a representative from the Tarrant County Medical Society. I'm a physician, double boarded in internal medicine and in pediatrics. I've been in Fort Worth for over 20 years now, been back in Fort Worth. I came here first as a minister, so I've been to seminary, and it's hard for me to get behind a pulpit and not talk for 20 minutes. And now you're making me compress it into 3, so I will talk fast. I really don't have a whole lot to say other than to say I wanted you to know that we were here. I'm president of the Tarrant County Medical Society this year. I've been very involved with it ever since I've been back in Fort Worth. We do a number of initiatives which I think are important to the community, and I wanted you to be aware of that. Some of them you probably already are, one of which is Project Access, of which I am the medical director. Project Access connects patients who basically fall through the cracks in the system, either because they don't qualify, because they're undocumented, or because they haven't done all the paperwork they need to be connected with JPS. At any rate, we have physicians who volunteer their time in order to be able to do procedures for them, colonoscopies, hysterectomies, yeah, you know what I'm talking about, and joint replacements and the like. So there's that. The other thing is I wanted to thank JPS for their support through the Foundation of Healthcare and Civil Society. I mean, Dr. Emerson was going to be on our panel one year and had an emergency funeral. You can't plan those things in advance. So, but the foundation has been very supportive over the years, and I wanted to thank, even though I know that's not what you all do. I did want to call attention to the fact that I did publish an article in our local Tarrant County Physician Journal that has to do directly with JPS. I sent a link for it to Blake today, but I wanted you to be aware of that because it does focus on JPS and undocumented patients and the fact that we don't take care of them here. I mean, you do, but at a discount, they're not eligible for JPS Connect. It's not a slam on JPS. We completely support the mission of what y'all are trying to do. It's basically what I'd like to see is for us to find a way to take all these silos of medical care and find some way that we can work together. As the Tarrant County Medical Society, I represent the 3,500 or so physicians who are members of the Medical Society, which is most of the doctors. A lot of the acclaimed doctors are not, and I understand there's a lot of reasons for that, but to the extent to which we are able to bring folks together to work toward a common goal of taking care of patients, especially those who are underserved, I wanted you to know that we are entirely committed to that and working with you, and if there's any way we can help, I would like to be part of that. So that's all I have to say.
All right, thank you.
Thank you.
Thank you.
Yes, Blake. Yes.
Yes, and I just wanted to thank Dr. Piquel for presenting to us today. Stuart is not just an ordained Presbyterian minister and a med-peds doctor, but most importantly, he is my parents' physician for probably the entire time you've been in Fort Worth, or most of that time. And so he takes very good care of my parents, and I appreciate your coming and speaking to us today. Stuart, thank you very much.
Thank you.
You are welcome to stay with for the rest of the board meeting if you like, but we will now return to our agenda. And the next on the agenda is the approval of our minutes from May 11th. Were there any corrections? If there were no correction, I'll entertain a motion. Okay. All right. It's been moved and second. All those in favor signify by saying aye.
Aye.
Those opposed by nay. Motion passes. Okay. As all of you are aware, the Commissioners Court passed a resolution this past Tuesday approving a 10% homestead exemption for both the county and the hospital district. The exemptions are effective January 1st of this year. Although the board was not asked to weigh in on this decision, we will continue to keep our focus on quality health care for the residents of Tarrant County. With this reduction in property, taxable property that will result from the exemption, and the discussion we are already aware of concerning our tax rate generally, I think it is prudent for us to convene an ad hoc committee. The purpose of this committee will be to work closely with the staff as they prepare for our budget retreat. Most specifically, I'm asking the committee to focus on gathering more information about our outside expenses, in which those related to services that we provide out in the community are on the behalf of third parties. Consider the impact of any cuts to all of our passive revenue streams, including tax cuts and other state or federal revenue that we receive as a safety net hospital. Make recommendations to staff that we can consider in preparing the budget draft that we will present for the board approval and ultimately to the Commissioner's Court. So that we have good representation on this committee, I'm appointing a board member from each of the commissioner members so that they may bring any additional perspectives that they are aware of. So the appointed members are Tim Davis, D.T., Leonard Firestone, Roger, I talked to Roger R. Trent, one of them will be on it, and myself, okay? Our CFO would like to meet with these appointed members briefly after adjournment of our board meeting today. So Trent, because of that, you're it, okay?
Yes, ma'am.
We will need the committee to wrap up any recommendations to the staff by the end of July for consideration in the budget draft. I think that will help us get ready for our budget and also be aware of what's going on. Okay, are there any questions? Okay, I want to thank you in advance for agreeing to serve on my committee. Okay, Dr. Duncan.
Yes, good afternoon. I do not have any major updates. We continue to be busy in the hospital, and just as always want to thank the staff and the individuals that come to work every day prepared and ready to see our patients. And so I want to thank all of those JPS team members that contribute every day to making JPS communities healthier. With that said, I'm going to ask Ashley Quinones, who is our GR person, to come up and give an update as the legislative session has finished. So Ashley, where did we land?
Good afternoon. Thank you, Dr. Duncan and board members, for allowing me just a few minutes on the agenda today. As Dr. Duncan referenced, our regular state legislative session concluded in recent days on May 29th, and I just wanted to provide a brief update of some of the significant pieces of legislation that you all have been hearing about this spring through the legislative session. Just a couple of round numbers. The legislators filed a little over 7,000 bills this session, which has been kind of on point with past legislative sessions, specific to health and human services, bills that would impact hospitals, bills that I personally put on my bill track to follow throughout the session. There were a little over 700 bills in total that had the potential to impact hospitals or healthcare providers across the state. So it really was what I would consider a tough session for hospitals, not just the sheer number of bills that would impact us, but a lot of those bills did have a significant fiscal or operational impact to them. So as a reminder, we focused a lot on healthcare workforce, on workplace violence prevention, behavioral health, Medicaid, supplemental payments, trauma, and managed care. Those were several of the key policy areas that we were focused on this session. The state ended up adopting a budget of $321.3 billion in all funds, and that includes the various supplemental appropriations as well. And for Health and Human Services specifically, there were 4 key bullets that I just wanted to make you aware of. The state did fund the $2.5 billion general revenue Medicaid shortfall, meaning that they will fund the Medicaid program for the entirety through this current biennium that we're in. There is always a Medicaid shortfall that the state looks at each legislative session and decides, are we going to fund the program through the end of the current budget cycle or not? And they did. They did fund the $180 million annually for the trauma add-on payment. So we are, benefactors of a portion of that, given the trauma services that we provide Tarrant County and the region. And those funds go to help us get to our cost, if you will, of providing those trauma services Services. They did fund $150 million across the state annually for a safety net add-on, and they did fund $147 million related to House Bill 12, which you may recall is a Medicaid extension for postpartum women and their children. Currently, postpartum, a woman receives Medicaid benefits for 2 months, and this extension would extend that to 12 months. So if that is signed by the governor, the bill was passed, but if that is signed by the governor and blessed by the federal government at the CMS level, that $147 million that the state allocated will go to provide that 12-month Medicaid extension postpartum for women in our state. A couple of other things regarding behavioral health. You will recall that Tarrant County itself was advocating for the state to fund a study to potentially look at building in the future a Tarrant County mental health hospital. The state did not allocate the roughly $15 million that the county was asking for that study. However, under the behavioral health umbrella, they, meaning the state, are putting significant funds, some of which will go towards forensic beds in counties, some which will go for civil beds, and some which will go for competency restoration as well at the county level. So, in meeting with the county, with Russell Schaffner there, they are hopeful that the county will be able to benefit from some of those funds to be able to fill in some of the needs and the gaps that they have from a behavioral health perspective. And just a couple of updates on specific bills. We talked a lot about healthcare workforce. Our team, specifically Jill and other nursing leaders within our organization, have been working closely with Teaching Hospitals of Texas, THOT, for which we're members of, on various innovative ways that the state could support nursing workforce more broadly than they have in past years. And a lot of those ideas landed up in Senate Bill 25, which was authored by Senator Lois Kolkhorst, who chairs the Health and Human Services Committee in the Senate. So we knew that this would move, given that she was the bill author and the chair of such a prominent committee. But a lot of those ideas around supporting our nursing workforce have culminated into this bill, which was passed, and it has been sent to the governor for his signature. It includes establishing grant programs that would support more training, more preceptor sites in clinical settings, as well as supporting nursing faculty or nursing leaders being able to serve as faculty in our academic institutions to kind of bridge that gap between the two and kind of forge relationships, if you will, between the two. So we're hopeful that the governor will sign that one. A couple that you all may recall in terms of workplace violence prevention, the governor has signed these two bills, Senate Bill 240 and then Senate Bill 840. They were probably some of the very first bills that the governor signed this session. They moved through the process really fast. Senate Bill 240 by Senator Campbell, that is the one that amends the Health and Safety Code to require healthcare facilities to adopt, implement, and enforce a written workplace violence prevention policy, maintain a workplace violence prevention committee, and prohibits discipline or retaliation for good faith incident reports. So we talked last month about how beneficial this will be not only to JPS, but to the healthcare industry as a whole. And that goes into effect on September 1. And then the other one, Senate Bill 840, with regards to workplace violence by Senator Royce West. This makes assaulting an on-duty hospital worker a third-degree felony. And this, again, was signed by the governor in May, and it will be effective September 1 as well. I mentioned House Bill 12 by Representative Rose, that is that Medicaid extension. This has passed. This has been sent to the governor. If he signs it, then Health and Human Services Commission at the state level, they will have to send this on to the federal government for them to approve it, to bless it. And if they do approve it, and if they do it in a timely manner, it would be effective September 1st. That approval process may take some time, or, they could not approve it. I don't know what the federal government's going to do, but that could delay, the implementation of this Medicaid extension piece if in fact the federal government takes their time in looking at that for approval. And then real quickly, as many of you know, you can often measure success, if you will, in any legislative context with bills that did not pass. And so I wanted to highlight a couple of those that were defeated in the process that would have had significant financial and operational impact to JPS. One of those was House Bill 1692, which was related to the prohibition of facility fees in outpatient settings. There was incredible advocacy against this particular piece of legislation. There was incredible number of hours spent in conversation directly with the bill author, directly with committee members for which this bill was assigned to, and at the end of the day, it was not passed. So that would have had a multi-million-dollar impact on JPS if we were in the future not to be able to charge, a facility fee in our outpatient clinic settings that, go into oftentimes supporting the operation of those outpatient clinic settings. The other one I wanted to mention that was defeated was House Bill 633, also by State Representative Frank. And this one dealt specifically with the state government setting maximum and minimum rates for certain services provided to our patients. And so instead of us working with the managed care organization to determine the rate, or working internally in our own programs to determine rates and whatnot, this would have gotten the state government way more involved in that process and setting some maximum and some minimums, and could have had a negative financial impact on us as well. So in closing, I'll just say that, over the next several weeks, we'll continue to analyze a lot of pieces of legislation, a lot of new laws. It takes considerable time to go through and really dig in to see the impact of a lot of laws that will be signed. The governor has until June 18th to veto or sign bills into law. And I just wanted to thank again those of you in this room and my colleagues that have been so supportive throughout the legislative process. I've relied incredibly on expertise, particularly on the financial side. How is this bill going to impact us financially, or how is this bill going to impact us operationally? And our colleagues have been incredibly collaborative and incredibly responsive and very timely in their, in answering my requests for information. So I just want to thank you all again for your partnership through the session, and I'll be happy to take any questions.
Actually, help me understand, and I may be confused on this.
Yes, sir.
The $2.5 billion Medicaid shortfall was funded. That's not what you're talking about in terms of having to go back to CMS to be approved for allocation,
No,
right?
two separate things.
You're talking about the $147 million.
Two separate things, yes, sir.
So
Yes,
the
sir.
$147 million, we're not able to allocate budgetarily what we expect that to be yet because we're not sure that's going to go, but
Correct,
not
correct.
anywhere near the kind of numbers we've been looking at based on that $2.5 billion allocation.
Correct. So every year when, like this session, the legislature passed their budget, a 2-year budget, they estimate what the Medicaid program is going to cost them over the course of those 2 years. They always underestimate. So when they come back for the next session, there's always, or at least for the last 20 years that I've been doing this, there's always a Medicaid shortfall. And they almost always fund it, but it's something that you can't ever take for granted necessarily, particularly in budget cycles that are a little bit more lean than this one was. So yeah, that's to fund the existing gap that we're in right now for the Medicaid program to get us through the end of this current state budget cycle. The $147 million is specific to House Bill 12, which is the Medicaid extension for postpartum benefits.
And that's the one we're not sure yet whether or not there might be
Right,
financial.
that's the one that the federal government will have to. So last session, the state passed a 6-month extension for that same program to go from 2 to 6 months. The governor signed it, they sent it to the federal government for their approval. The federal government has never approved it. They wanted 12 months. Our state didn't give them 12 months, so in my opinion, they dug their heels in, and it's just been sitting there.
Yeah.
They said, no, we're not going to approve it, and it's just been sitting there. So this year, the state actually wants the full 12 months, so they're hopeful the federal government will approve it. But then again, they could decide to dig their heels in again. I don't know.
Thank you.
Yes, Tim.
Yes, sir.
Anything in the special sessions you think that will touch us?
So we've been following the property tax relief discussion pretty closely. A lot, as you know, remains to be seen in regards to what is actually passed in regards to property tax relief. I know the county, our county commissioner, certainly Russell, again, that leads their advocacy there at the county, has been following that really closely as well. So I think, just a lot remains to be seen on how that might impact us. But at the end of the day, I think it will, depending on whatever plan is decided upon, for sure.
You think it'll just be taxes? There won't be anything else that
No,
substantive?
I don't think there's anything that'll be healthcare specific or hospital specific. I think it'll just be what is the financial impact to a county's budget with regards to the state property tax that's passed, and then therefore, what are the downstream, impacts of that to different county units or different county divisions. Yeah.
Thank you.
So, thank you.
Okay.
Thank you again for the opportunity. Appreciate it.
Thank you. That's it? Okay, thank you. All right, thank you, Dr. Duncan. Okay. Next, we have Dr. Miles. You have privileges next.
Thank you, Madam Chair. The first item is request for approval of the medical staff appointments and privileges. Again, they're in your red folder for your review. I have nothing to report outside of the memo that I'm putting forward. These individuals are all fully vetted by the medical staff process, and there's nothing of concern.
Okay.
Move approval.
Okay. All right. All those in favor of approval of the privileges signify by saying aye. Aye. Those opposed by nay. Motion passes. Okay. Delineation of the privileges form for the
The
radio.
delineation of privilege form for radiology physician assistant begins on page 11. Again, anything in yellow is an addition or modification. There's a lot of yellow this month. Let me try to explain that for you. The previous delineation of privilege for this APP did not specifically list out all of the privileges that would normally be associated with a core practice of radiology PA. So those are listed on the revised form on page 11 and on to page 12. And then there's a number of non-core procedures that were split out from the core as requiring separate training, education, and competencies. Those are on page 12. And please also note we are adding the levels of supervision required for each procedure type. So that's all new information that we are adding into pages 12 and 13. And that is the only one we have this month for you.
Okay. Yep.
Let me ask a question.
Yes.
Dr. Miles, since this is brand new, is this a new position for JPS, or do we already have radiology PAs?
We already have them under an old delineation of privilege form, so this would represent a new form for them.
Yes.
I know there's a lot of regulatory changes in mid-level authority and what they're allowed to do. Obviously, this incorporated that. In a general sense, are we tracking that stuff and our mid-levels are following? Do we need to stay on top of that more? What's your sense on that?
It's a great question, Tim. So the way we manage that is when the DOPs come up for review, which now they're on a recurring annual or biannual review schedule. So this one was meant to come for review. It's not a new DOP. It's a revision. When it comes back up, we have legal counsel at our side to help us ensure that all of the procedures coming forward are within scope. So that's to say within the scope of practice for the APP in the state of Texas.
Yeah.
And that is state determined. It varies from state to state.
Okay, well, let us know if we need to act faster, because I want our folks to be able to do everything that the law allows them to do. And so if you need us to move faster in the process, of course, let us know that. And then my other question, does this generally, I notice this is for a PA, does this generally track the same delineation of privileges for a CRNA? Or is there some difference there?
So this is a privilege form for a radiology PA. These are the physician assistants and the APRNs who are working in the interventional radiology area. There's a totally separate.
I left off half my question.
Oh, I'm sorry. Well, I'll let you finish it then. Go ahead.
So
it was really easy question.
I know,
so
you
far,
could,
but.
yeah, totally different practice area. So and so let me get to I guess the half that matters. It kind of back to my first question is what I'm asking. Are we typically seeing for PAs the same type of, and the reason that I had CRNA on the brain is because that's what's been relevant for me lately. For CRNAs where we have mid-level nurses and we have mid-level PAs, do we tend to see their privileges overlap, or are there things on the margin? And so my question, better stated, in the equivalent of a nurse practitioner that assists in this field, are those privileges overlapped, or are there things on the margin that we're having to watch one provider be able to do that another cannot?
So any provider can take their form, and for example, let's just pretend I'm a radiology PA and I'm applying for privileges at JPS. I would apply for the core, that all of us do the core.
Perfect.
The non-core, you pick and choose.
Gotcha.
I can do them all, I can do none, I can pick 3. It's totally up. It's based on my education, training, and experience. So I have to qualify for it if I want to select it.
Great.
So it's not exactly what you asked, but the idea being it is going to be different per provider depending on training experience and education.
Okay. Yeah, no, that makes sense. And it may just be something that we work with our legislators on and our regulators on to try to get a little more consistency to it, too. Yeah, thank you.
Okay. All right. Thank you. All right. Any other questions? Okay. Then I'll entertain a motion for approval.
So moved.
Okay. All right, thank you. It's been motion and second for approval of the physician assistant radiology privilege form. All those in favor of the approval signify by saying aye. Aye. And those disapproved by nay. Motion passes. Now, Dr. Miles, are you doing the?
Yes, ma'am.
Okay, all right.
Yes, ma'am.
All right.
This is the neonatal level 3 program plan resolution. This is not the results of a survey. This is a resolution we are asking from the board to pass today. This is a requirement for Texas statute to keep our level 3 NICU program in compliance. The medical staff through the medical executive committee has already reviewed this document and we have approved it. The resolution from the organized medical staff is included in your packet. And I got to say, this is a really fantastic document.
Yes,
it's extremely well written. It's crosswalked to the Texas statutes, which it's covering. And if you don't know anything about our NICU program, all you have to do is read this document and you'll know everything. So it's incredibly well done. We're very proud of our level 3 NICU program. The only thing that keeps us from going to level 4, which is the highest certification status, is that we don't have subspecialty pediatricians on site. That's the only piece that we're missing. We utilize Cook's Children's subspecialty pediatricians if we need them, and they are always available to us, and it's a great collaboration between us and Cook's. Okay. So this is here for your approval of the resolution on page 15, I think.
Yes, okay. Are there any questions? I'll entertain a motion for approval. All right, Ralph and Amanda. All those in favor of approving the resolution signify by saying aye. Aye. Those that disapprove by nay, motion passes. And Dr. Miles, it was that nursing has such a big role in that. I was looking at Jill to say, is she coming up and present there? So that was the reason I was asking that question, but it's a great document. Yep. They do a wonderful job too. Okay, next we will have committee reports, and for Finance, Planning, and Investment Committee, Trent.
Thank you, Madam Chair. DT is not able to be with us today from a family illness, so I told him I would step in. We did not have a planning meeting this month, so I'll limit comments to finance. The May 25th Finance Committee. Remember, just a couple of reminders for the board. Please contact Lonnie regarding your availability for the two scheduling workshop dates so that she can make sure that we've got maximum number of people attending those dates. BKD will be beginning, that's our audit firm, begin their field work in July for the 23 audit. Our financial report was given by Sharon. Consolidating operating income of 13 compared to a budget of 6. Our increases right now are really due to the variations that come from the supplemental funding with HARP, which I think most of you were there at that meeting to hear that. We also received a $10.6 million tobacco trust revenue versus a budget of $9 million, so that was positive. Salary, supplies, drugs continue to exceed budget. These are, however, on line with additional expense expectations related to volume. And year-to-date operating revenues have exceeded budget with strong performance, so we're blessed to be able to report that. 6 contracts were approved and presented to be able to be verified by the board today, and I'll be happy to answer any questions.
Are there any questions for Trent? Okay, thank you, Trent, for the report.
Yes, ma'am.
Amanda?
Thank you, Madam Chair. May 25th, the Human Resource Committee met and the HR Committee approved the CEO contract and will present the recommendation in closed session today. Thank you.
Okay, all right, thank you. Okay, next on our agenda is to consider approval of nomination of Sharon Clark to the Tobacco Settlement Permanent Trust Account Investment Advisory Committee. So can I get a motion for approval? Okay, all right. It's been motioned and second for Sharon to be nominated for the committee. All those in favor signify by aye. Aye. Those opposed by nay. Motion passes, okay? All right, then next I'm up to the consent agenda. Are there any items that anyone needs to remove from the consent agenda? Okay. There being none, I'll entertain a motion for approval of the consent agenda. Sam? Ralph? Okay. All those in favor of approval of the consent agenda signify by saying aye.
Aye.
And those that disapprove by nay. Motion passes, okay? Now, I think I'm at where I close the open session and we go into closed session. So I will end our open session now, and then we'll go into closed session by 2, okay? Okay. Everybody, a minute break. we will not be taking any action on today. Okay, there being no further business, I will entertain a motion for adjournment. All right, we are adjourned.